Good afternoon. Welcome to the EMA office here in St. Clair County for day 677, where we bring you the latest information on our COVID fight. Joined here with Chairman Mark Kern of the County Board, and also Mila Blanford, Director of the St. Clair County Health Department. And Mila, you have this week's numbers.
I do, Herb. A little bit better than last week. Still going in the wrong direction, but a little bit better. For the reporting period of January the 13th through January the 19th, we have a total of 4,697 new positive tests out of a total of 17,603 for the reporting period. The age range of those positive individuals is under 1 into their 90s. The weekly county positivity rate is at 26.7%, with a 7-day rolling average at 26.7%. The regional positivity was at 24% as of January the 16th. Our case rate right now for St. Clair County is 1,363 per 100,000 population. Last week at this time, we were at 2,032 per 100,000 population, and as recently as yesterday, we were over 2,000 per 100,000 population. So we have seen a little bit of decrease in the case rates of the transmission rate here in the county. Unfortunately, we do have 12 new deaths to report today, 2 males in their 60s, 5 females and 2 males in their 70s, 2 males in their 80s, and 1 female in her 90s. Countywide, we have conducted a total of 667,293 tests, consisting of 61,593 positives and 605,700 negatives. Total number of deaths to date is at 639, and our condolences go out to those families. Statewide, we have conducted a total of 48,960,282 tests. Total positive of that number is 2,709,474, which is an increase of 186,521 from last week. Total deaths to date is 29,510, which is an increase of 706 from last week. For St. Clair County hospitalization numbers, the total number of COVID hospitalized patients in St. Clair County is at 129. Regionally, we're at 282. Patients on ventilators in St. Clair County is at 4. Regionally, we're at 15. Randy, would you like to share the graphic from the hospital? We can see that we currently have 129 hospitalized patients with COVID in St. Clair County. That's in comparison to last week at 136. Around 73% of those individuals are unvaccinated. We currently have 16 in the ICU. That's in comparison of 15 of last week. About 68% of those individuals are unvaccinated. We currently have 4 individuals on ventilators. Last week we were at 5. That's 100% of those individuals are unvaccinated. Okay. Randy, would you like to show the age graphic? We can see that we have about 15.5% that are age 10 and under for positive cases. In the 11 to 20 age range, we have 15.8%. And cumulatively in the 40 and under age group, we have about 63%. Last week, we were at 58.7. For congregate care, announcing those that are in outbreak status, we have Brea of Belleville with 3 new cases, Brea of Mascoutah with 5 new cases, Bradford Place of Swansea, 2 new cases, Brightly Senior Living, 3 new cases, Cambridge House of O'Fallon, 3 new cases, Caritas Family Solutions of Belleville, 15 new cases, Caseyville Nursing and Rehab, 6 new cases, Cedarhurst of Shiloh, 6 new cases, Cedar Ridge of Lebanon, 1 new case, Cedar Trails of Freeburg, 7 new cases, Colonnade of O'Fallon, 9 new cases, The Shrine, 1 new case, Freeburg Care Center, 16 cases, Four Fountains, 4 cases, Garden Place, 3 new cases, Gateway Foundation, 3 new cases, Integrity Healthcare of Belleville, 9 new cases, Integrity Healthcare of Smithton, 1 new case, Lebanon Care Center, 4 new cases, Memorial Care Center, 4 new cases, Mercy Rehab and Care in Swansea, 3 new cases, St. Paul's Home, 20 new cases, Swansea Rehab and Care Center, 1 new case, Sycamore Village of Swansea, 7 new cases. Okay. We continue to offer vaccine Monday through Friday at 330 West Main from 10 to 6. You can drive up with no appointment. For the 5 to 11 age group, we continue to offer vaccination clinics at the health department. You can call 825-4447 or go to our website for social media and register. Testing is still offered at St. Clair Square 6 days a week, Monday through Saturday from 8 to 4. In addition, the covidtest.gov site is active, so you can go online and enter your email address and receive over-the-counter tests. They expect those to be distributed later this month. Those are from the federal government, so that's another resource out there. As well as the Vax Verify from IDPH, you can go online and print your immunization records, or if you need that QR code to prove your COVID vaccination status, you can get that printed at that site. Okay, Chairman?
Great. Thank you, Mila. So, Herb, I think you got some positive news this week about staffing that may be coming to the area?
Yeah, some of the hospitals have put in requests to get some relief for their nurses, and hopefully that's going to happen here the 1st of February, especially at St. Elizabeth's and Memorial. And we were excited about that news, and hopefully that will help give those frontline workers out there a little rest. And
so it's actually personnel that'll be coming.
Personnel will be coming in to help them out. Yes, so we're really excited about that.
That is a good thing. And speaking of BJC Memorial Hospital, today we've got a special guest with us that we all recognize, Dr. Omer Bodeman, who's the infectious disease specialist. We'll put a "the" in front of it because you certainly are our infectious disease specialist for this program, and we appreciate you being here today. So let's get started. What do things look like at your hospital?
Well, this is the worst we've had in the 2 years. Since the COVID-19 pandemic started, we have the highest admission rate compared even when we first started 2 years ago. So we had close to 103 to 105 admissions last week. That's the highest we've ever seen. And as it's not a mystery, we're seeing a higher rate of infection nationwide. We're counting at 700 to 800,000 a day, where we're seeing 156,000 hospitalized, and we're seeing close to, I think, 2,000 deaths a day. So definitely with this new Omicron strain, we are seeing higher infection rate and also hospitalization rate.
So because of that, the higher rates, then is that the reason why we're seeing more deaths than we saw before?
Yes. Unfortunately, there is a concept that because this virus is deemed to be slightly milder than the previous variant, the Delta variant, somehow most people took comfort in that. But what is happening is that this virus is making up for being mildly not as virulent as the Delta strain. It's much more contagious. If you look at it, it's almost 30 times more contagious than the Alpha strain and twice as contagious as the Delta strain. So the sheer volume that it's out there infecting, and the fact that we have only 62% of the United States population that are eligible for vaccine are fully vaccinated. You have 38% of the population that's not vaccinated being exposed to extremely highly contagious virus. So the sheer volume of what it's capturing is finding the weak and the vulnerable part of the unvaccinated population. It's very interesting that I round every day in the intensive care unit on both Memorial Belleville and Memorial Shiloh. We don't see any patients that are vaccinated on a ventilator. Even when we see patients that are vaccinated or boosted and end up in the hospital, we rarely see death from that. There is some concern out there that says, this vaccine may not be working as well for the Omicron strain. That may be true because as virus mutate and the antibody that the vaccine produces is going after certain area of the virus, and at that virus change, it may not be as efficient, but it still works very well. And the fact when you get a booster or you're recently vaccinated and your antibody levels are extremely high, it still protects you from hospitalization, ending up in the ICU, or dying from it. So what I'm seeing is over 90% of the patients that are admitted in our hospital, whether in the ICU or on the medical floor, are unvaccinated. And we get that small percent that are vaccinated but not boosted. And even a tinier, smaller percentage that are fully vaccinated, but for some reason their immune system didn't respond at par. So the take-home point is the vaccine works even for the Omicron strain. It works better when you have either you are boosted or you are recently vaccinated within the past 5 months. If you get your antibody levels in your blood very high, even with this Omicron variant, the vaccine is still effective and it prevents you from dying, from ending up in the ICU or having complications.
So we've been at this for a couple of years now, or close to it, or I guess 2 years really is where we are. Are the treatments, have they progressed, and is the time length that you're seeing of patients spending in the hospital, has that been reduced?
Yes, I mean, we've come a long way from the day one when we started. We had no idea what we were doing, and all we did was supportive care. And later on came the Decadron, and then after that, remdesivir, the antiviral. And now we're having 2 new oral antivirals that are going to be coming immediately soon for not hospitalized patients, but it would prevent, just like we did with the flu and the antiviral for the flu. We are using immunomodulators that prevent the immune system from overreacting. So we're pretty good at taking care of the patient once they end up in the hospital. But with all that said, the most effective treatment to this day and the most preventative treatment to this day is the vaccine. And you get the vaccine, you're not going to be that 90% of the patients that we see in the hospital who end up either in the ICU on a ventilator or die from the virus. So we see a very small percentage of the population that die even when they're vaccinated. I know it can be confusing sometimes. That's what I commonly hear in the hospital. Oh, my aunt got the vaccine and she got sick. And the follow-up question is she in the hospital? No. Did she do okay? Yes. So yes, the vaccine does not give you 100% protection, but definitely it prevents you from being in the hospital, in the intensive care unit, on a ventilator, or from dying. So I think that's the most important point we need to get there. We have 38% of the population in the United States today unvaccinated. And I know it can be confusing. Things are changing from time to time as messages are being sent out there. But you have to remember, this is a very novel virus and it's a moving target. And we are adjusting to the change with the virus. But I can still say safely, the vaccine is the most effective thing. And I really want to hit the point that those who are not vaccinated should get vaccinated. And we have a larger population, the children between the age of 5 and 11. Our vaccination rate is dismal. And I can say that confidently. I have a 5-year-old, I have a 6-year-old, I have a 9-year-old, and I have a 13-year-old. All of them are vaccinated. The 13-year-old actually got his booster. It's very safe. It's very effective vaccine. It's one of the most effective vaccine and safe vaccine I have seen in my 21 years or 25 years of career.
So if we're looking in a crystal ball today, where do you think we go? Will there be a yearly vaccination ultimately? Is that what the things are pointing to? Or are we always going to be at the mercy of the next variant? And is a variant created, not to multiply too many questions, but is a variant created by one person just getting this in their system and then giving it to someone else, or is a variant among multiple people that together create this variant that we talk about, whether it's Omicron or Delta?
Yeah, with the variants, the fuel for variants is the more people get sick. This virus is changing every 7 days. So the more people it infects, the more it learns and becomes fit. And with this Omicron, it switched its receptors on the spike protein so that it can adjust to infect more people and to evade the antibodies. So the variance is because people out there are getting infected and they're allowing it to breed. It's the fuel for the variants. unvaccinated population that keep getting infected. And as the virus circulates among the population, it's going to change. That's its nature. Question about probably, yes, we may have to live with this for several years as it goes. But I think from my experience with this virus is that as the population is vaccinated or becomes more familiar with the virus, we're going to see it becoming more of a seasonal virus than the more pandemic type of strain.
But the more people that remain unvaccinated, the better the chances that we'll see another variant.
Absolutely. It's the fuel for the fire. It's the unvaccinated that transmits the virus from person to person. And as that happens, viruses change.
Herb?
I'm just amazed. I mean, Doctor, I really appreciate that information. I think you just put it all in a nutshell. I've been sitting here listening, and the best defense is that vaccine. And we've got some people on here, of course, we know we've talked about them before. No matter what we explain to them, how we explain it to them, they don't believe it, they don't care. I'm listening to the doctors, I'm listening to the science, and I don't know how you can dispute that when you have those facts and numbers that you live with daily. Our nursing staff lives with those people that are in there, and that percentage, why you would not want to be on that percentage of having that preventive, I just can't understand that.
I think I understand there is a fear. And unfortunately, in my 25 years of career, I have never seen so much distrust like I have seen now with this the coronavirus pandemic. I don't know why, and I can't explain it. But your best. We have had a track record of vaccines and medications being very well scrutinized in the United States. We have good agencies that really look out for the interest of the general public and well-being. So I still have faith in that, and I still have faith that we make one of the best medications or vaccines in the world under appropriate scrutiny. So I wish I had an answer for that.
Yeah.
But
and I say the same thing. When you have those facts and the statistics speaks for themselves, you're not sitting here making up those things. You're living them. And when you talk about the people who have taken the vaccine, have reduced the possibility of getting the virus and being in intensive care, being on a ventilator, that's all I have to hear. I mean, I know people, and I like what you also said, there is no 100% guarantee, and that's one of the questions that we get all the time. Well, I've taken the vaccine, I've taken a booster, but I still got it. And the question, like you said, yeah, but did you end up in the hospital? Did you end up in intensive care? Did you do okay with it? And then they say, well, yeah, I had it just for a couple of days, it was like a cold. The bottom line is because you had the vaccine.
Absolutely. I have had transplant patients, heart transplant patients, liver transplant patients, kidney transplant patients that ended up in the hospital. But because they were vaccinated and they have at least some antibody in their system to protect them when they were exposed to the virus, they do well. They go home. And then I get the other opposite. 50, 60-year-old healthy, maybe one risk factor, slightly obese, or maybe mild diabetes, and they end up on the ventilator and dying from it. So yes, what we see in the hospital is something that most people don't understand and don't seem to comprehend what we see. So I think that's the problem. Did we fail communicating this to the public? I'm not sure. But doing this for 2 years, I know one thing for sure, that the best and the most effective way of protecting yourself is the vaccine, even with this Omicron strain. And the nice thing about this new the vaccines are they can be adjusted if we need to in the future. So yes, the vaccine, and the vaccine. And then I think the other step that we need to start doing is testing, make sure that we're screening more people. and using masks, and in indoor area to use masks such as the K95 and the M95. This common sense stuff that we can avoid big gatherings. I think what really pushed all this higher numbers that we're seeing is between the Thanksgiving, Christmas, and New Year, indoor, and it was a good summer actually. We had the number of cases going down so low, and everybody was confident, and we got caught off guard, and that's what happened. And unfortunately, we didn't prepare for testing, which now is another important role in fighting this pandemic. Is we have to test more, vaccinate the other 38% that's not vaccinated.
Well, and that's what we wanted you to come in for today, to explain that to us, and I think you did an excellent job, as always.
I think so too. We really want to thank you. I know, you know, the stress of your life in the past 2 years has to be incalculable. The amount of hours that you put in, the nurses and the other doctors and all the staff in these medical facilities have to be worn out, and we appreciate that. We know that. That's why we're here. We're trying to help wind this down in any small way that we can to inform the public, so that we try to get a handle on it.
Absolutely. I mean, the common enemy here is the virus. Regardless of what policies, what politics, what religion, what affiliation, it doesn't matter. I think the common enemy now that everybody has to understand is the virus. And we are fighting this virus, unfortunately, divided.
And I'm glad you said that, Doctor, because we just had this conversation this afternoon. This virus, and we've said this for 677 days, this virus don't care where you live, doesn't care your political beliefs, your religious beliefs, and it's a virus that we're fighting.
Absolutely. And it's doing a better job than we are.
Yeah.
Unfortunately.
Because people won't get vaccinated.
But we're sure lucky that we have you. If we get sick, we know that we're in good hands. Best hands possible.
I can say that the healthcare providers in this area, yes, they are, and all over the country, I think that they are taxed, and it's a lot of strain and stress, and we worry that eventually people may exit this line of work. But overall, what I have seen in the past 2 years is, I think, sometimes bad things bring good people together. And this is what really I have seen in the hospitals, whether it's the nurses, the respiratory therapists, administration, even environmental services, volunteers, and that. It's been wonderful. It's been a really very close-knit community that's working very hard to serve the community. And so we need the help of the community. That's what we need. We're doing our part, and I have said that many times in the past. We will do whatever it takes to get us through this pandemic, taking care of everybody, whoever steps into our hospital. But we really need that 38% of the public that is non-vaccinated to really think about it. Talk to your physicians. Talk to the healthcare providers that you really trust. And step up and get vaccinated. Because this is a volunteer-based, and we want everybody to volunteer to fight this virus.
Very good.
Thank you.
We appreciate it, Doctor.
Thanks for being here today, taking time out of your schedule. We appreciate it.
Wow.
That's
Explained it just
cannot be any more
clearer than that.
Well, let's take a look at the zip codes for today, Herb. I guess if we want to say there is a little good news, many of the zip codes went down. We did have a few that still are rising, but it looked like we did have a number that went down today, so we'll hold on to that. So in 62059, we're up 7 to 95 people. 62201, we're up 68 to 1,221 cases. 62203, up 84 cases this week to 1,426. 62204, up 27 to 943. 62205, we're up 66 to 1,431. 62206, up 162 to 3,009. 62207, up 58 to 1,457. 62208, up 283 to 3,795. 62220 up 355 today to 4,416. 62221 is up 613 to 6,343. 62223 up 261 to 3,700. 62225 up 117 to 629 this week. 62226 up 501 to 6,781. 62232 up 126 to 1,797. 62239 up 71 to 1,033. 62240 up 24 to 339. 62243 up 122 to 1,434. 62254 up 111 to 1,433. 62255 up 14 to 195. 62257 up 59 to 662. 62258 up 259 to 2,317. 62260 up 111 to 1,517. 62264 up 39 to 740. 62269 up 747 to 7,511. 62282 up 11 to 130. 62285 up 92 to 1,117. And 62289 up 17 to 110. Regional positivity this week is down to 24%, and the 7-day rolling average is down to 26.7%. Numbers still way high, but at least they're starting to tick downward. We're starting to see that, I think, in the region, and so we hope that trend continues, Herb. But these numbers are really way up there, and it was clear today from Dr. Bodeman that if you are fully vaccinated and boosted, your chances are small of ending up in the ICU or ending up on a ventilator. And no one on a ventilator that's been vaccinated.
Right, and the key points that he made there is just what you said there, and plus, there's not a 100% guarantee, and that's some of the comments that we're seeing on our feed today. Nobody has ever said that. Nobody will ever say that. Just because you get the vaccine doesn't mean you're not going to get the virus. It just gives you that defense to help it be a milder case. You heard the doctor say that. And as I said earlier, I'm following the doctor. I'm not following anything else about that. On another note, we gave the mask away to giveaway last week. We had 11 communities so far come and pick them up. Those communities being Belleville, Cahokia Heights, Dupo, East Carondelet, East St. Louis, Marissa, Millstadt, O'Fallon, Sauget, Freeburg, and St. Laborie. The other ones can still call that haven't got theirs yet, and we'll make sure that they can come and pick them up. But for those of you that live in those areas, they were given some their mask and some PPE to be distributed. Again, I can't say enough thanking Dr. Bodeman for coming in today, explaining it. He's been here before.
Many times.
Many times. And I wished we didn't have to have him back, but it was just at a point where we thought that, there are still people out there who haven't made their mind up. Like he said, talk to your healthcare provider. And I said it a couple of weeks ago. If you got a question, if you're not feeling good, you go to the doctor, and what the doctor prescribes, whether it be a new medication or a new treatment, we rush out and we get that done because our doctor has told us that. Well, this doctor here today, one of the best out there when it comes to this type of situation, said our best defense is the vaccine. And I would just ask that if you know somebody who hasn't got it, whether it's in your family or friend or whatever, tell them, go talk to their healthcare provider. And I'm sure you're going to find out that it's the best thing you can do to help get us these numbers down and we can get back to normal.
And Herb, getting vaccinated also allows there to be bed space in the hospital for people who have other things wrong with them. People are still having heart attacks. They're still having strokes. They're still having a lot of health issues that still exist, and yet the beds are scarce. because they are being taken up by people who could have done their part and gotten vaccinated.
Exactly, and there's still auto accidents happening. You name it, and that's what we worry about. Our nursing staff, our doctors. Are maxed. They've been doing this for 677 days that we've been here, and we want to see that light at the end of the tunnel again. We were there. We were, how close we was. Remember? And then all of a sudden, it just skyrocketed on us, and everybody says, "Well, yeah, we're going to have that for the rest of our lives." Well, we don't know that. If you know that, then you must have a different crystal ball than
and
other
we've been vaccinated and boosted, and
Yeah.
we're here and knock on wood.
Yeah,
We've been doing okay, so we're
going to continue to do what we're doing.
practice what we preach.
Each and every week, we're going to continue to be here until the science tells us otherwise. We'll be back next week, and we'll let you know unless something else comes up in between. Everybody, it's a little longer today, but it was well worth it having Dr. Bodeman in here. So we'll see you next Wednesday here at 3:30. Have a good evening.